Awesome, keep it up. And then.
All right, I will.
You're going to share. Okay, there we go.
Here we go. All right. Okay. So Maria, Sam, and I are working with Dr. Hunter, and we're looking into parent-to-parent networks that support parents of deaf and children who are hard of hearing. And so just like everyone else, we're going to walk through our background, project goals, talk about our policy partners, and then what we've been doing so far for this project and what we plan to do next. So starting with just some background information, what we see in the literature when we're looking at families or parents of children with disabilities, and this is broad disabilities, kind of across domains, we see that parents sometimes report feeling isolated or that they just don't have the support they need and they're not getting all the support they need within their doctor's office. And that connecting with other people who have similar experiences can be really helpful for them. And I think specifically within this population, it's important to know, I know Dr. Hunter gave a really nice talk a few weeks ago about children who are deaf or hard of hearing. And most children who are deaf or hard of hearing are born to parents who have typical hearing. And so there's kind of that gap of understanding maybe what's going on, what their needs are. And as Dr. Hunter talked about, usually there are some decisions that need to be made really quickly when those diagnoses are made. So having some people and some support to work through that can be really helpful. And so parent-to-parent networks have been identified as a way to support parents who are in these positions. Parents involved in these networks report feeling just more confident in their own ability to meet their child's needs. They have better relationships with their child because of some of the understanding and experience that they gain from other parents. Just more positive outlook and perceptions of what's going on, and better able to navigate the complex resources that they might need to meet their child's needs. So we know that parent-to-parent networks can be really effective across disabilities for supporting families. And right here I have one of our policy partners. Maria is going to talk a little bit more about them, all of our partners later. But this is Dr. Sheila Moody, who's at Western University. And she and her team have done a literature review looking at what are effective models of parent-to-parent networks, when do they work most efficiently, and what do we need to do to make a parent-to-parent network that works. So they, across the literature, found that it's really important for mentors to be trained in specific ways, learning to give information in a way that's not overly biased, that presents facts and is supportive, having some kind of match between the mentor and mentee, whether that's based on their child's age or disability or just general life experiences. And so she got all these findings across the literature and put them together in this model that has a lot going on, but I think is also very fun to look at. And just talked about, so we have the supporting parent over here on the left, and then the parent who is receiving the mentorship, so kind of the new parent, if you want to think about it that way, over here on the right. And it's really a relationship where they're trading things with each other. They're both kind of surrounded by contribution and connectedness, so some feelings of warmth and having that support together. And then they're supporting each other in these ways of empowerment, so feeling like you know what's going on, you know the resources you need, having that really specific knowledge of this is where I can go in the community to get this for my child, or this is how I'm going to have to advocate in their school. And then just general well-being of taking care of the family, their relationships, their emotions, having someone to process with who has been through a similar experience. So these are kind of the elements that come together that make a parent-to-parent mentee relationship really helpful for the family and ultimately for the child. So there are a few organizations that support parent-to-parent networks. Hands and Voices is a larger organization that provides a lot of services and support for families with children who are deaf or hard of hearing throughout the United States and Canada. Typically the model works that you have one chapter in each state, and then some states within their Hands and Voices, so it's kind of umbrella, they have the Hands and Voices, then under that they have, or part of it, Guide by Your Side, which is where the parent-to-parent network is. And so the Guide by Your Side parent-to-parent networks have a really established kind of curriculum for how they establish their programs, train their parents, and connect mentors to mentees. Not all states have a Hands and Voices, so some states just have their own parent-to-parent networks that are established in other ways. But basically, we know that parent-to-parent networks are out there for children, for families of children who are deaf and hard of hearing, but we don't know what's going on in those networks necessarily, and whether or not they're mapping on to what we see in the literature as being a successful network, back to that slide I showed before. So that brings us to our project goals and our research questions. This is kind of part one, where we want to understand what are the models that Hands and Voices chapters specifically are using to establish their parent-to-parent networks. And then where there's not a Hands and Voices chapter in the state, what are those states doing to create their parent-to-parent networks for families of children who are deaf or hard of hearing? And then we want to just kind of exploratory understand how they're establishing these networks and whether or not they align with that framework that Dr. Moody came up with the ultimate goal of then seeing, well, how does state funding relate to this, and how do we need to advocate for state funding in order to support the development of parent-to-parent networks? So that's kind of our background and goals, and I'll pass it over to Maria to talk about our policy partners.
Yeah, so to reiterate what Kate said, the focus of our questionnaire is to almost compare and contrast these organizations, like system-wide, what are they doing, and how does that compare to another chapter, and how does that compare to the framework that Dr. Sheila Moody has in the literature. So that was kind of the focus of our questionnaire, was we're looking at these systems, what's the framework, and what characteristics of the chapters most closely identifies with all of these other descriptors. So for example, we're looking into what year they're providing data on their chapter. We're going to ask the leaders of these organizations to describe the demographics of their chapters. We're asking them what training the supporting parents have, if any, and we're asking impacts on COVID, the roles and responsibilities of the leaders themselves, the demographic, are the mentors, how they identify their hearing level, hearing parent of a deaf or hard of hearing child. So going into all of those different things to best compare and contrast the framework between Guide by Your Side, Hands and Voices, and then systems that are outside of those two. So for our policy partners, we have National Hands and Voices. We worked with various directors. We have Ohio Hands and Voices. We have Cincinnati Children's. We collaborated with Derek Houston and Rachel Freshholt from Ohio State University, Ursula Finland from Nationwide Children's Hospital, and Dr. Sheila Moody from University of Western Ontario. And so these policy partners, one helped us identify the framework for the direction of our questionnaire and the benefits of parent-to-parent network, so that we can now investigate the dynamics between systems of parents who have children who are deaf or hard of hearing. They also helped us aggregate data for the current systems and guide our questionnaire and what to focus on. They helped us analyze existing data to apply the questionnaire, and then they helped us narrow down details of our survey components.
The methods in our study is, Marina kind of alluded to already, is to send out a questionnaire to gather qualitative and quantitative from all of our stakeholders. We submitted for IRB and it was determined to be a non-human subjects research. And so we had the IRB waived, which was wonderful. And it is a descriptive mixed methods research, like I said, gathering both qualitative and quantitative data. So first, our step was to create a questionnaire to send out to each of our stakeholders, and our policy partners really helped guide what they thought was really important for, what kind of information was really important from each program to kind of narrow down. We had this really long questionnaire at the beginning that we kind of narrowed down to get exactly what we're looking for this part of the study. And then, so next what we'll do is we're going to send out that survey to representatives from each group. They'll receive an email that explains the study and the purpose of it, and attached will be the questionnaire to complete and provide their data. We plan to hold informal virtual sessions to support and answer any questions from the stakeholders pertaining to the questionnaire. These are going to be kind of voluntary, and they're kind of in the works right now of getting scheduled and figured out. But the goal will be to provide any support that the stakeholders may need to answer the questionnaire as accurately as they can and answer any questions that they might have. And then once we get all of the data back, we're going to analyze all of the data and kind of figure out how each of our representatives from each state handle their parent-to-parent networks. So to date, we have clearly defined our project goals and our background. We've completed the questionnaire in collaboration with our policy partners, and we submitted for IRB submitted for IRB approval. And our questionnaire is now officially complete, and it's in the process of being put into REDCap so that it can be vetted for any errors that might need to be fixed before we send it out to all of our stakeholders. Some of the challenges to progress, obviously the COVID-19 pandemic is going to be a challenge for everyone's projects, creating potential delays in responses from our policy partners and from our stakeholders if they have representatives who may be out sick. And then that may cause collection of data to be a little bit delayed as well. So next steps, we're planning to be vetting the questionnaire in the coming weeks, and we'll be sending those out to begin data collection. The data or the questionnaires will be out for collection for several weeks to give the respondents time to complete that. And then we'll plan to analyze the data and create an abstract and final poster for the presentation.
And just wanted to mention some of the MCH competencies that have gone along with our learning and work this year. Definitely critical thinking and communication, working with our interdisciplinary policy partners, as well as being interdisciplinary on our own team, and then working with communities and systems and thinking about how these networks are formed and how they can be supported by their states or other funding. So that is all we have. So we're happy to take questions or comments or feedback that people have.
This is Karen, Karen Burkett. That was another terrific presentation. I really got a sense that you were looking to understand how families can be supported in a better way than they currently are. Nice job. I loved your slides, thought they were fabulous. And I wondered, so I had two questions, but I'll just ask the first one. So you had a lot of policy partners. I know in our project, we just had two. So I wondered, how did you reconcile all the feedback that you get from a variety of policy partners and the input that they provide? That's a lot of folks to have contact with.
Yeah, I can kind of, oh,
Go ahead.
I can kind of touch on it and then you can add anything you want. But we with Dr. Hunter, we kind of like had her connections. So from there, we conferenced virtually with all of these people, probably like every other week for SEBM. And then we had some collaboration over email. So we would have a shared document, we'd send it out to our policy partners to review, and then some people would add input via email, someone add it to the document directly, and then we would conference to talk about it or change it.
Yeah, there was a lot of moving parts there. So the shared doc, we had comments everywhere, people responding to comments to kind of come to a consensus. The great thing about the pandemic is that we were all used to being virtual, and so it was really kind of helpful that everyone had at least some experience with collaborating online, which made it a little bit more seamless to get all of everyone's input.
Thank you.
I just want to add to that. I think a lot of that was possible because the team worked so well together, and each of them had some specific background knowledge that they brought to the project, but also some excitement about it, which really I think was inspirational to our policy partners, because we spent some time at the beginning giving them a chance to get to know our LEND students. And all of the folks that I knew that we worked with all said, wow, you are so lucky to be able to work with these students. They not only have this great knowledge that they're bringing to the table, but they're enthusiastic about your project. This is really going to be great. So they were very happy to work with us, and I think really enjoyed that experience a lot, or they're still with us. So they're still involved, and I think they've enjoyed that.
I may have missed this, ladies, but how many questionnaires do you plan to send? And so how much feedback do you anticipate getting to like looking at and analyzing?
We're hoping to get responses from each state's organization's representative. And in our study, we plan to also write down and acknowledge states that didn't respond. But we're only sending out one questionnaire. So all of the information will be in one REDCap link. And then we're planning to host some meetings that are optional to answer any questions that they might have about that.
Which is nice, because most of your stakeholders are going to have a vested interest in this anyway. So you don't have to, sell it. But if you do happen to need any act early materials to share out, I'm happy to provide those as nuggets.
We are planning to take advantage of the fact that we're connected with LEND and MCH, and then through like the national EDI program. And one thing about the Hands and Voices policy partner, they have a grant through MCH that's called FL3, which is a family leadership project, where they are required to report back data and progress. So they too have a on all states. So they have a real vested interest in us getting data that's going to help them, demonstrate current progress, but also the need for future support. So we're planning to use that kind of, what am I looking for? Carrot.
Other questions? All right, well, hearing no questions, let's go ahead and take advantage of a 9-minute break and come back with our next group at 4 o'clock. Okay, thanks, ladies. All right, I believe next up is Karen and Karen's team. So whoever wants to share their slides. Get my timer, not my calculator. Ready? Give everybody a minute to get back.
Anne, who's your visitor?
This is Izzy.
Hi, baby.
Hi, Izzy.
We're doing lots of snuggles as we both recover from COVID. It's awesome.
Yuck.
Yeah.
Future
It's
Lend
a-
leader right there. You just,
That's
what is it, Lend? It'll be Lend, what, 2047.
Oh my gosh,
Something like
that sounds so far away.
So wild. Yeah,
Yeah.
so cute.
Okay, can you guys see that?
Thank
Sure
you.
can.
Okay, I'll go ahead and get us started.
All right.
Oops, sorry, clicked too fast. Our project is disseminating developmental toolkits for Head Start teachers and staff working with children to promote development. The project is working on the project is myself, Shannon, Nicolette, and Taryn, and we're working with Karen Burkett and Karen Harpster on this. So before I get started, I was just going to do a little review about what Head Start is, because that's the basis of the project. So Head Start is a federally funded program which provides preschool education to kids ages 3 to 5 for free as long as they qualify. And it prepares the parents and the children for kindergarten. Head Start is provided at a specific school within the county. So it's not at every school, it's at a specific school. Why is Head Start in the toolkit so important? So it's stated in the last slide, children in poverty are 40 to 60% more likely to experience developmental delays. And Head Start is offered to kids that are below a certain income threshold. African-American and Latinx children are more often diagnosed with developmental delays or disabilities. And when they are diagnosed, it's often 2 years later than a non-minority child. So the early diagnosis and treatment improves child outcomes in long-term development and academic readiness. So how and why is this important? 1 in 6 children ages 3 to 17 have 1 or more developmental disabilities. Children identified with developmental disabilities who get early healthcare and preschool services show improved cognitive behavior and social outcomes. Their general education placement increased by 20%. And then on top of that, if they receive therapies, they can improve their cognitive, communication, and motor skills. So 90% of the students that receive Head Start services do not require special education interventions once they reach a regular school system. So the benefits of the Head Start program are huge. Head Start teachers and staff face several barriers in providing the early intervention services. The first big one is the caregivers, that sometimes the caregivers for these children have a distrust of healthcare and education systems. The cultural knowledge of the signs of developmental disabilities, also just the stigma of your child being delayed, or the stigma of your child getting labeled with a disability. And then sometimes the undocumented citizenship comes into play. There are also healthcare factors, just the reduced healthcare access, the referral rates for developmental disability services are low, and then the inadequate primary care resources to track referrals. And then when you put these two things together, the communication that isn't there between the healthcare, education, and community services also offers another really big barrier. And then on top of that, like the other group shared today, COVID comes into play, and just getting children identified or screened for developmental disabilities right now is a huge deal. Okay, so I'm going to give it to Shannon.
Thanks, Julie.
Mhm.
So the purpose of this project was to help teachers and other school personnel to not only have a tool to share with families to grow in their developmental skills, but to also grow the teacher's skills in growing or in engaging in difficult conversations with parents. It's also important to mention that these tools are not just for children with developmental challenges. The tools can also provide children that are on target with the next set of developmental skills, overall promoting the child's strengths and growth in various tasks and skills. Next slide, please.
Sorry, hold on, it locked for some reason. Sorry, I'm going to unshare and reshare because it's locked. Shannon, do you want to share yours? I'm sorry, mine's just frozen.
No, that's okay. I can share I can try and share mine.
Do you have it up, Shannon, or do you want me to do it on mine?
Nicoletta, if you wouldn't mind, that would be great. So last year's Lund cohort worked to develop the evaluation handouts, the activities handouts, and the various discipline handouts. Our cohort has worked on formatting the handouts to ensure that they are at an appropriate reading level. Next slide, please. And then we worked on the projected. This project was developed through the following steps. So the determination preferred training method of Head Start teachers, the dissemination and evaluation use of evidence-based toolkits for children at Head Start, exploring educational and training needs of Head Start parents for their children and evaluating the acceptability of materials and dissemination programs for the teachers and parents. Next slide, please. So we have been working closely with policy partners, which have included disability coordinators and teachers in the Head Start agencies in Cincinnati. We are hoping to expand our policy partners in various other disciplines in areas such as education and speech pathology, to name a few. Various questions that we've asked our policy partners at our collaborative meetings have included, basically, we're trying to get their feedback on the toolkit. So we've been asking them questions such as, like, what are your thoughts on the toolkit, what they think is missing, what they think the teachers would think of these toolkits, questions regarding the toolkits, items in each category, and how they see it being used. And these were very beneficial in helping us to go back and edit the toolkit and make necessary changes in order to best serve the teachers' needs in the classrooms.
Sorry, it would not let me unmute. It was giving me the full screen and I have no clue why. Okay, are you guys seeing presenter view now? Perfect, awesome. So I'm going to go through our toolkit materials and what we have. And I also included in the chat box a PDF of all of our different materials that we have and the handouts that we've corrected so far. So while I have a couple of them in our slides for you guys to see, if anybody's curious to see all of the ages, all of the different activities and whatnot that we've done, you're more than welcome to look at that PDF within the chat box as well. And so the toolkit materials were broken out into different sections for the handout. So we have our activities ones, which have been the primary focus for our group thus far this year. Evaluation handouts, education and advocacy handouts, and then there's been some other ones that kind of fit into this broad category based on what they found last year, and then additional feedback like Shannon had mentioned from our policy partners this year. So our activities handouts are to provide caregivers with the activities to practice with their child, and they're all based on developmental milestones. And so we tried to group it as much as we could to make it more accurate for the kiddo. So we have problem solving activities for 1, 2, 3, and 4-year-olds, all separate for each of them, as you'll see in the PDF. We found that for motor activities, it was much easier to combine fine and gross motor for those younger kids. So we have one for the 12 to 24 month, and then one for the 25 to 36 month. And then for the older kids, for the 3 and 4-year-olds, we broke out that fine and gross motor activities more and for them because there's more variety. And then similar for language activities, we kind of grouped the 1 and 2-year-olds together since there's not too much that happens in that first year. It's kind of starting to work on language building up, and then did 3 and 4 separate. A lot of what we worked on, as you can kind of see, this was the handout that they originally had put together from last year. And this was just kind of a big activities for kids 12 to 24 months. As we were going through, we found that there was a lot of wording. It was very cluttered. And while they had the bullet points, it was a little bit more difficult to follow. And we also had looked at what was the reading level for everything. So we've been trying to lower these reading levels as much as possible. So again, we took this one, which kind of was a broad of everything, and turned it into, we have our motor activities for the 12 to 24 month olds and language activities. And on our next slide, I also have problem solving activities. If you see with each of these, we try to make the bullet points a little bit more spread out, very short. And then we've added pictures within to try to give families ideas of what to do with some of them. I know we've talked about this with other groups. We had difficulty finding pictures that weren't all just Caucasian families. So we really tried to make a point of trying to do stick figures or trying to find that diversity of finding dads, finding different children, finding that variety within each of the kiddos within our pictures. And then the next step after the activity handouts have been the evaluation handouts. So with these, our goal has been to describe the different role of the healthcare providers who may be supporting the child and the family. And so say, hey, this is why you're being enrolled, referred to physical therapy, speech and language therapy, occupational therapy, psychology for some of our examples. And then our goal was to try to give caregivers a heads up of this is what may happen at that initial evaluation, what to expect when you're referred to these individuals. And then again, the one on your left that's highlighted in purple was the one from last year. And the green one is the one from this year where we tried to condense it a little bit more and keep the verbiage the same between each of the handouts too. So we made sure that the wording for the speech therapist is similar to what was for the physical or occupational therapist and so on. So if families are being referred to several, they're not getting different language with each of those. And then we have education and advocacy where we're trying to work on advocacy skills for the family and trying to help the family. How am I supposed to talk with my primary care provider? How am I supposed to talk with these different people? And who are other resources? So one of those is increasing the family's awareness of social workers in particular, since a lot of these families, as we've mentioned, are potentially lower income, may have English as a second language and other issues. And another one we're working on are common medical terms, because as much as we really try not to speak in medical lingo, it always comes out. And so we're trying to give parents a good reference handout to say, hey, when somebody says this, this is actually what they mean from there. And so these are ones that they're still kind of in progress with everything. As we said, we've tried to go bits and pieces, and the activities one has been our primary focus thus far this year. But we're slowly working on what to do from here. And then we are also trying to make sure to list all the different primary care providers, knowing that we have doctors, nurse practitioners, physician assistants, it could be a DO, an MD, and so on and so forth. So we're trying to be all inclusive as we're writing this, knowing that some people are like, wait, what is a primary care provider? I see this type of person. Is that who you're actually talking about, or is this somebody different? And again, similar to what we talked about earlier, as we're going through all of these, we're still looking at the overall reading level and trying to continue to lower it as much as we can within it. And so this is one that we're recently just finished. So like, how can a social worker help you? And just trying to keep it very broad, giving families ideas. What can we do? And anything else from there. And then I will pass it on.
Thank you, Nicoletta. So right now we're working on the implementation and dissemination of the toolkits. So as we've previously mentioned, we've been updating the toolkits based on the feedback that we've received from our Head Start policy partners. This would include adding visuals, making sure our verbiage is consistent within all the forums that we're using. And again, working to lower the reading level, as that was something that was really kind of emphasized as we spoke with them, that parents are struggling with that aspect of it. We also developed and distributed a video for the teachers to kind of help them understand the toolkits and how to use them. At the bottom, there is a QR code, and you can scan that with your phone, and that will take you to the YouTube video. We didn't think that we'd have time to post it, but we thought that it'd be really helpful for you to have that visual aid. We also provided electronic and laminated copies of the updated handouts for the Head Starts. Our future steps, so we are getting a survey sent out by the end of January, beginning of February, to evaluate the toolkits to the Head Start leaders. We are contacting our Head Start policy parent group to present at an upcoming meeting to get their feedback to see where they are. And we'll also be working to revise our advocacy and education handouts. We plan to meet with our Head Start policy partner groups between the 1st and 2nd week of February to give the people time to get our survey feedback so that we can evaluate that and have something to give to them as well. In this meeting, we'll be considering other tips that they suggested when we started, but we want to see how effective the actual toolkits are. So that would include translating the handouts into other languages that are popular within the Head Start communities that we're working in, considering making videos for the activities, again, just to have that extra layer of visuals, and creating additional handouts, specifically how to handle difficult conversations about developmental concerns as far as talking to the parents and parents talking with their healthcare providers. And that's all. Again, that is our QR code for our YouTube video. Are there any questions?
Welcome.
Oh, sorry.
We are here to talk.
I was starting your video. Let me pause that. There we go. I have a question about just where do you all see differences in what you're working on compared to the Learn the Signs Act Early materials?
Does the group want me to answer before I jump in?
Yes.
Yes. Okay. Okay. So the group we started these tools last year, and it was part of the process for our SEBM team last year. So our current group, who have done an awesome job of meeting the kind of tight deadlines that were set by Head Start's rollout, they may not know that that was our basis last year for developing the toolkit items. And what our team this year really honed in on was feedback from our Head Start partners, Head Start policy partners, that these needed to be simpler, specifically the disability coordinators and the speech and language pathologist that was on our one of our policy partners this year, were very helpful in recognizing that the language content was a bit high, that there were too many to-do things on the list because we didn't, for the age of the child and the motor need. And so I want to commend the team on not only listening to the feedback from the Head Start policy partners, but also recognizing themselves. We have the advantage of having a pediatrician a social worker, a speech and language pathology student, and an educator. I hope I didn't leave anybody out. Maybe I did. Social worker. Anyway, who recognized that there were some pieces of this that needed to be simpler so that families could adapt them for themselves, not just the teachers, but our ultimate goal is that this would be shared directly with families.
So I think that especially the pieces that I commented on the chat box that Nicoletta presented on about what do each of these roles do and like what would an evaluation look like, those would be so fantastic to get on our Act Early Ohio page. And I would love to talk further about how we can get those translated and outreach to our Latinx promotorist who's working with us on the Act Early. But I think we probably just need to talk. So unfortunately, I'm not supposed to share specifics, but before you pull the launch cord on anything specifically, the CDC is coming out with new developmental milestones on February 8th. And it's like a dagger to the heart, honestly, because I don't like the methodology that they used. They only basically used like 53 children to create these new developmental milestones, which, right, we're all cringing like, what? But we provided our feedback as the Act Early Network that it wasn't a good idea. They went for it anyway. I'm not sure why. So I don't think that your toolkit materials will change, right? Such a small sample size. We were like, what do you mean? I don't think that your activities will change much, but I don't know. So I just want to kind of keep that in your mind and stay involved with your project through the end of the year and beyond, maybe, just because I think so much of what you did can be additional materials, but if they change up some random things, then you never know what it could look like. And I don't know those specific developmental milestones that are changing yet. They were kind of keeping it hush hush, just that it was changing on February 8th.
We really appreciate that heads up. That is phenomenal information.
Yeah.
Also, your point about translating. So I think maybe one of the members of our team would like to comment on how we moving forward. And I think, Taryn, you discussed this, but maybe in a little more depth, how we'd like to, that was a big emphasis of the team, that we make sure it's translatable and even do a video. So I don't know if anybody wants to comment on that from our team.
Yeah, again, just adding another layer of accessibility. If our people can't read them, then it's really no use. In the Head Starts that we're working with, there's a high population of Spanish-speaking individuals. And I believe second to that is Nepali. There's a large Nepali population. So we are hoping to get the feedback from the Head Start leaders to see if they're actually using them and if they're actually useful. And then the next step from that would be to kind of survey and get an idea of which languages would be most useful to be translated into.
Like I said, we can potentially do some of that with our Act Early grant. So keep in touch with me. But yeah, this is, I mean, I'm also going to print these out and give them to my new nanny that starts next week so she can do all these things with Easton. So thanks. We still have a couple minutes for questions.
This is Lisa. I just have a question regarding changes with respect to the preschool promise that's really for all children relative to Head Start. And I know it's beyond the scope of this project, but I'm just curious about how that's changed Head Start, or has that resulted in any alterations in the program here locally in Cincinnati?
Do you want to take that, Steph, or do you want me to?
Go for it. I haven't been as engaged with the preschool promise conversations since before COVID.
It's actually enriched the preschool promise program, because the Head Starts in most cases are the parent and the model program for the development of preschool promise programs. So some of them actually kind of supervise and help to regulate some of the preschool promise programs. So it's been a benefit that Head Start has gone this path for preschoolers, and it's been used as a model for many of the preschool promises programs.
That's so great to hear, because I kind of thought that and had, seen some information that national model is starting to finally be recognized, and the need to adopt it more globally.
Good to know, Lisa. So are you talking about the national model for like preschool promise, or the national model for Head Start that you've seen recently? I haven't seen that.
For Head Start, just that, right, that all of that investment over the years, and the work and showing that it makes a long-term difference for those children is starting to pay off, at least here locally.
Good to hear. I'll have to look for that. Thank you.
Mm-hmm.
Great. Well, thank you all for that. And we will jump into our final presentation of the day.
Can everybody see that okay? Yes, okay. All right. We are here today to talk about the medical home concept for adults. So getting that beyond the transition from pediatric care and making that transfer long-term into the adult healthcare. One kind of special update that I wanted to say, I'm not sure how familiar everyone is with Dr. Freeman, but yesterday there was a public announcement that everything that we're kind of working on and discussing is now going to be named in his honor. So the center that we're talking about today will be named the Timothy Freeman MD Center for Intellectual and Developmental Disabilities. For anybody that's not familiar, he's been in the field for 30 years and has done a lot of amazing things over time. So this was a really special and great announcement to see happen. So a little bit about the background. Some of even these flyers will be updated as they kind of go along, but the current work that they were having going on was primary care, psychiatry, and they did have like a transition clinic and a lot of other things, but they really wanted to take it beyond and making sure that there was a place where they could come for a variety of services and based off of some of the national clinics that they're studying. So the vision was become a national leader in providing healthcare to adults with intellectual and developmental disabilities. And the other segment of it is training future physicians on the care, so that multidisciplinary center of excellence, so that there will be coordinated, compassionate healthcare provided to a historically underserved population. So our main policy partner is Dr. Lauren Wong. And I'm going to turn it over to Pat.
Okay. One of the things that brought the four of us to have an interest in this project was because we personally had someone, or we personally were involved with finding it very difficult to transition our family member from pediatrics to adult medicine. But the irony is that there are so many people who are encountering the same thing. So we kind of looked at some data, and what we found was that according to the CDC, and the CDC listed as healthy people, so both the data is on both sites, is that in the US, there's approximately 61 million people living with a disability. And it's even larger when you look at the World Health Organization. But significantly, there's a growing need for what's called patient-centered medical homes for this population. So when you look at adults 18 to 44 living with an intellectual or developmental disability, 1 in 3, like primary care services, or actually access or utilize those services. And we're going to talk about why that may be difficult. And then 1 in 3 are at a greater risk for obesity, diabetes, heart disease, all of which also put you at risk for diseases such as COVID. So there is a void there in the access and the ability to utilize services, not just from an acute episodic perspective, but then also from primary, secondary prevention focus as well, because that's been lacking in this population as well. Next slide, please. So I just kind of pulled this. This is a synopsis of what our national health goal says, and that's what drives the practices of medicine. It says promoting healthy living, monitoring public health data, researching and reducing health disparities, building inclusive health programs, and improving access to healthcare. And this is for the IDD population. So I underlined improving access to healthcare because, as I showed in the slide before, the data supports that that's just not happening when they transition from pediatrics to adult medicine. Next slide, please. So we were charged to look at the role of a what was called a patient navigator. Some call it a community navigator. Would that be beneficial in this facility or with this facility? So when we started the research, we found that there was very limited information, not on patient navigators or community navigators. That concept and that role has been around for a while, but as it related to the IDD population, that was what was so narrow. And there were also limited studies in the US. There were more studies that were abroad, even though we did find one study that was actually between Vanderbilt and the University of Colorado, both colleges of medicine. But of the literature that we did find, there was a suggestion that there is a need of a multidisciplinary team if there is going to be a facility that is going to specifically address the needs of adults with IDD. So in essence, a one-stop shopping so that they don't have to maneuver through the healthcare system, which is part of the biggest challenge. And then also the role of a nurse navigator or a navigator in transitional care. And in many of the articles, the word nurse was used, but we know from talking with our policy partner is that the nurse can sometimes be so overwhelmed with the other things that she has to do or accomplish that she can't take care of the things that are time consuming. Like, how do you access to get food stamps? Because that's an issue. And because there's obesity, so she can't or he cannot address that. So we're looking at the possibility of a navigator. And so the use of a community navigator or transitional navigator, all of these terms are kind of flying around. And in a couple of the articles, again, keep in mind, some of these articles were on the national level, some were on the international level, such as Canada, Australia, who are basically integrating in the role of navigator as a part of best practices for facilities that are specifically providing that transitional care to adults. Next slide, please. Okay.
So what came out of that is we kind of went about developing 4 main goals that we were going to target throughout this time. One was to develop a resource guide, a document that we could provide that potential upcoming community navigator with local resources that would be good to start them off with getting connected to so that they don't have to explore too much. We're giving them some resources to start with, some conversations to start with. Identify university, you said, and adult IDD healthcare facilities. We're looking for that triangle of connection and how they can all support one another in this process of serving families. Comparing and contrasting the role of the community navigator versus an SSA. We're going to talk about that a little further in, but that was one of the challenges that we received further on into our conversations. And then developing questions for an upcoming needs assessment. So that resource guide, we really took some time to, as a group, discuss what are the main areas that we need to make sure that we capture. And especially from our different varieties of backgrounds, as we're having these conversations, we had a lot of really great and unique things that came up from each person in our group. So we conducted reviews and all that information that we learned from Pat in these previous slides. And we created that online document, which has links. So it makes it very easy. So when we send that over and provide that to that community navigator, everything is right there. It has categories and explains what those resources are and how to get to them. I'm going to hand it over to Jason.
Yeah, so we also wanted to see what other places were doing. And so we wanted to look at whatever you said that had adult IDD healthcare facilities within the university or the university system. So we looked at, we took a view of all the 57 states and territories that are going and looking at what every single one of them was doing and then narrowing it down to look at what had a medical home for adults, that might have transition clinics or resources available, that was provided within the university, that might also have things around disability competency or sort of other things within a system. So it wasn't just the medical piece just necessarily, but working within other systems like social work and other things. And then being able to realize that probably no one or disability studies or other sort of things, and then being able to choose 5 that were diverse enough to where they sort of overlapped in some of what they were doing, but realizing there probably isn't one place that does all of this, to be able to make sure there was the widest breadth to be able to take different pieces from each of those sort of models.
This mute button. So the next component was that comparing and contrasting. This one kind of arose later on. So one of the things that occurred is Dr. Wong was visiting, and she got some kickback on us really trying to identify what the differences would be of this community navigator position versus what our local counties have, which are service support administrators. So those are typically our families that are connected with waiver services and county services. They are assigned or provided an SSA. And that SSA is really providing an umbrella of services and supports and conversations for that family. So we started to try to figure out, how are we going to define this role as different and put a unique value behind this role? So we're working to complete interviews with various professionals and families. And then our goal is to provide that feedback to Dr. Wong and the potential future community navigator. So we have completed 2 interviews, one with an SSA and one with someone at Dr. Wong's practice, and we have more scheduled to come.
And Christy, if I can add to that, is that one of the difficulties with a program that's just getting off the ground is that funders are always asking the question, are you duplicating services? And so that was one of the challenges that was proposed to us, because when you're going after funding, that's what they want to know. So we actually had to help come up with why having the navigator is different from the SSA.
I'm going to pass it to Andrea.
Sorry, I had the mute thing on. So one of the proposed methods in the progress regarding another part of the project that is important to us was developing a needs assessment since this is basically something new that is not in the community, and we're trying to target so many different aspects of the center home. We needed to know what the population is needing, and we just didn't want to assume that the physicians or, so I'm sorry, I'm a little bit sick, so I don't know if you guys can hear me, but just didn't want to assume, and we wanted to do one of the needs assessment. This has not been completed yet. This is under progress because the part of our, project has had many different stages. And we have a little bit of the preliminary questionnaire in which we are trying to develop some of the ways that we're going to target our population. So probably self-advocates and the family members. We want to introduce the idea of the Center for IDD, but we want to see, again, like I was saying at the beginning, what do they want? What do the people, what do they believe that is the greatest need in the community? So build it on the base of the need, not on what we think, is the best thing. But this is still in the progress, and I think that's what we're going to be working in the next month.
Yes, and Andrea, just to add to what Andrea was saying, one of the studies that was published in 2018, it was conducted by Vanderbilt and the University of Colorado, both their colleges of medicine, was that some of the barriers that families were facing was access to primary care services, and then also primary care physicians feeling not qualified to take care of people with IDD. And because as they quoted, this is something we so rarely see. So they thought that a center like this it would be more beneficial for the patient, but then also then it raised the question, then do we need to better prepare physicians and healthcare providers?
And so some of what we do, what the progress that we're making, it's evolved a little bit as we're getting different things to different requests or different, as we're learning more of what needs to be done, but it's focusing on what groups need to be targeted for what type of, for questioning, and making sure that we're hitting it sort of from a multi-systems approach of making sure that people with disabilities and their families are being asked questions, making sure that paid supporters and people who might be taking people or who might be doing everyday health type things or wellness type things are being approached, and making sure healthcare professionals themselves are being approached on what would be helpful in a collaborative space, especially as somebody knowing that what is a primary care physician doing or a dentist doing, or somebody who's more of how can we make sure that all these things are meeting people's needs and people are getting the best quality of care, and then whom to specifically ask, because there's a lot of people, but making sure that we know within those communities to make a diverse representation of who's within field, to what families are being expected, what type of transportation and things that would go alongside that, and then also learning what is already out there, whether it's families wanting to know whatever resources that could be part of the network, if somebody wants, if people need more geographic, what sort of like with knowing what the difference between what an SSA is doing versus what the community navigator would be doing, and how those roles complement each other. So just really knowing what the landscape is as well.
And then just some of the challenges that we have had within this project is just, since it's something new and we're trying to come up with ideas of how the center is going to be done, and moving in different directions to try to cover every aspect of healthcare and mental health and all the social needs. We have changed in many directions. So I started with the idea of what do we need, but then the assessment of the community, and then finding the SSI. So it was a little bit challenging for us, just having different directions and ability to complete tasks sometimes, because we were so excited about these. So we know the need in the population. We all have passion for adults with special developmental disabilities, and we needed to be the redirector a couple of times. Amy will say that. And then, some of the, I'm not sure if Christy can expand a little bit more, or Pat on the second one. And I think all of us have been, since this is something new and we're just coming up with the ideas, we are not seeing the actual thing being built yet. So the measurability of our progress and the success is something that is going to be a long-term, goal. So at this point, we're doing like the building blocks of this huge project. But it is hard for us to know, where all of this is going to lead yet. And just, have to remember always that this is a long-term dream, and have to remember every time that this is the big picture, and we're trying to do those little pieces, but we're going to continue being involved with the project, as this gets bigger. But I think those have been one of the challenges. And the team, do you guys have anything else to add?
I would say the only other unique aspect was that one of our SEBM leads was on pregnancy leave. And so we even kind of put that in there too, of just like we had a unique representation kind of shift occur. And so just kind of working through that, which is, Izzy's on here, so we love seeing him. So next steps is really continuing to work more on that community navigator versus the SS role. So we're going to continue doing more interviews, meeting with other counties and other professionals, and then also making sure that we interview individuals that are receiving those services and how we can identify that we can make a difference and where there are gaps that we can identify. The other aspect is that needs assessment. We know that we're not going to complete and create the needs assessment, but our mission is to provide recommendations. So continued discussion and developing key questions. Another important thing is that when we talk about the community navigator, we're talking about people served by the county. We want to make sure we get representation of that 75% that are not connected to those services. Questions?
I think this is an impressive project. I cannot believe the goals that you all put out there. Those are impressive. And so when you have a number of goals that are this significant and will contribute significantly to the work of the center and moving the needle forward on serving individuals with IDD in the adult community, it also can be frustrating. And I see that you really outlined very well for our understanding of what the challenges of the project are. And so in thinking of that, I would hope that if you all could comment on what you believe have been some of your best accomplishment and successes to date, because being able to complete all of those goals might not be attainable within this time frame that we have. And I think it's important that you recognize how much you have accomplished so far. So maybe someone could comment on that, what you feel have been your biggest successes so far, because they're impressive.
I mean, I know for me, and I think it's a group's done an amazing job of being able to get all this information and sort of put together sort of a plan of action and realizing what is doable in the time frame that we have and what can be helpful for laying the groundwork for the next group of people, especially knowing that we probably won't see it but be 100%, but being able to feel, put down sort of the groundwork at sort of the beginning of the process, which is one of those things that is so important but tough, because not because it isn't, because you don't necessarily know what is next, but being able to take all that data and then also be able to put it forward. I think it's been really a great process, and I mean, working with everybody's been amazing. Sorry.
I think what I see is that when we laid down the track or the information for the person who will be the navigator, is that we actually included everything we wish we had or that our family member would need. And that creates hope. It doesn't matter whether we see the end of this, we know that this baby has been formed. And whether we give birth to it or somebody else, we know that we're a part of this baby growing up. So, but I thank you, Karen, because, sometimes when you're in the thicket of things, you actually don't think about, just how great of a job you've done because you're in the middle of the work. So thank you for bringing that for my attention in particular, because until you said that, I was like, I didn't even think about that. So thank you for bringing that up.
I would agree. I feel like my joy is coming from the fact that I feel like on both my professional and personal life, like paving a pathway that's going to be better for the families that I'm connected with and for my brother. I mean, I dream about everything in this about my brother, that I know I'm going to be taking him to the doctor, and how can we make this process easier that my mom doesn't have to make 7 phone calls every time she has a need.
Yeah, thank you, Karen, because it is hard to remember when we're pulling so many directions and trying to have this big dream. And then for me, I think looking back at it, I think I was thinking about it today, was the power of our team was also being so diverse, like learning so much about, African Americans, for me, from Pat and from all the struggles that they have had. And from my perspective, like Spanish speaking patients, we were able to put a lot of ideas and some concerns with Dr. Juan about how are we going to serve those populations? How are we going to do translators? I think that a lot of medical systems come up together without having us on mind yet. And then we are an add-on later. But being part from the beginning, from the, groundbreaking for this project. It has been amazing to be heard from the beginning, and we're making sure that these will represent the institution later, like that diversity and, you know, those needs that they need to be addressed from the beginning. So I think that has been very, I don't know, very inspiring, and hoping that, yeah, this will change the life of our adult loved ones. Because I'm doing this for my sister, and hoping that, you know, this develops as our big dream, I think, for our whole team. But it has been a joy to work with all of them and learn from all of them, and I have forgotten, so thank you.
Hi, everybody. This is Jen. I have a comment and a question. Comment is I'm really excited about this project because we've had other projects in the past that have focused on adolescent issues and transition. And the trainees that come in do a great job, and they, you know, get interested and they get motivated to do this work. But you all are like in it to win it. And came here like for this reason. And I just think it's so cool to see that investment like from the very beginning, that like I have no doubt that you all are gonna make things happen. So I just wanted to say that because you can just feel it as you all talk about it. So cheers to that. Question, I was wondering if you guys have gotten connected yet with Elizabeth Trenkamp, the DWP family navigator, who has an adult daughter who she's experienced a lot of these things just from a transition standpoint, and I think could be a really valuable resource if you haven't connected with her yet. So I would just encourage you to do that.
Jen, can you repeat her name, please?
Elizabeth Trenkamp.
Okay.
I have her on our list. I just haven't brought it. Yes,
Okay.
thank you for the reminder, Jen.
Perfect. Yeah. We got to get all of the
I can rope her in.
Yeah, get all the people on this, and you guys are gonna move mountains.
She's one of the most organized human beings I've ever met. So she can probably just like hand you a way to organize all the resources that you can add to your tools. And I just want to emphasize too, sitting at conferences before COVID, when we were actually in person, and going to sessions where we would talk ad nauseum about transition age youth. And it was the elephant in the room was always, we can talk about transition all we want, but if we don't have anywhere for these adults to go, it's not really going to serve us any good. And so this is just so exciting that this resource is going to be, developed. And I know Dr. Wong has been doing this, and with a couple other folks, just a little bit here and there, but this is really going to expand. So kudos to all of you. Thank you guys for your efforts, because this is really cool that, the pediatric people can stay focused on pediatrics, and we can have really adult focused folks, that can do that. So it's really cool. So kudos. Awesome. Well, anything else today, everyone?